Iron deficiency is big with women. Why? Because we have periods, we get pregnant. Those are particularly two states where iron deficiency can become more common, more likely. And remember, when we have iron deficiency, that can lead to other issues, can cause anemia, but also symptoms. We're talking about fatigue, feeling sluggish, getting pale mucous membranes, feeling like even things like shortness of breath or palpitations, if it does lead to anemia. And low iron levels can cause a lot of problems. So iron deficiency is definitely one of those things that as women, we have to look out for. Guys, I'm Dr. Jen. We're talking about 4 common deficiencies, nutritional deficiencies in women. So not only that, but let's go to vitamin B12. Now, vitamin B12 can be low for a number of reasons. As we get older, it can become low for different reasons, digestive issues, etc. Certain medications that we take can interfere with vitamin B12. Also, if we have a particularly restrictive or restricted diet, maybe we're not getting all of our nutrients from different places, that could cause low B12. And there are other underlying medical conditions that can do it. The thing about low vitamin B12 is that it can cause memory problems, issues with sort of the way that you think and you sort of comprehend. It can also cause problems with gait and balance and coordination and stuff like that. And it can do other things as well. So vitamin B12 is something that's often on my list for not just women but men, but certainly on my list for women, especially when certain issues or symptoms come up. The third one is a vitamin D deficiency. Now, this one probably does not surprise you. So many people are vitamin D deficient. I am as well. By the way, write in the comments if you have any of these deficiencies. So far, we've talked about vitamin D, vitamin B12, and iron deficiency. And for those of you watching on YouTube, I have videos specifically on these deficiencies, what symptoms they can cause, ways to fix it, etc. So make sure you click on the linked videos as well. But vitamin D deficiency, so common, especially if you have darker skin like mine. In terms of sort of getting that vitamin D can be tough if you don't live in climates where there's a lot of sunshine. By the way, I don't want you going out in the sun to get your vitamin D because there's a risk of skin cancer. But the point is, a lot of people have vitamin D deficiency, and that can contribute to a number of things, such as fatigue, may play a role in sort of bone or muscle issues, and so much more. So that is always something on my radar. And the last thing that I want to talk about, and these are certainly not all the vitamin and nutritional deficiencies that women have, but some of the more common, is calcium. Right? Certainly as we get older, calcium is such a big player in our health, especially our bone health. And in terms of going into perimenopause and menopause, getting enough calcium can be tough. We need calcium to keep strong bones and to regulate other things in our body. So that is something you definitely want to talk with your doctor about. Now, one thing I'll say about all these nutritional deficiencies, I don't want to just throw them out and say, aha, this is what we can have. Good luck. Remember that these vitamins and minerals and things like that, these substances can be easily gotten from a number of different foods. If you're not able to take in certain foods, there are supplements. There are other ways as well. So make sure you're talking with your doctor about if you have these nutritional deficiencies and what you should do about it. Also remember that many of these things we can check levels. So before you start taking a vitamin or a supplement or anything for these things, you need to check with your doctor first, because many times we can see really what your level is and if you need something, and if so, what you need. Guys, I'm Dr. Jen Caudle, practicing family physician. Again, write in the comments if any of this sounds familiar to you. Please subscribe to my channel on YouTube. I'm on Facebook, Instagram, TikTok, LinkedIn, WhatsApp, you name it, Threads, all the things. Please subscribe to my free health newsletter at drjencaudle.com. Okay.